Knock, knock. Hello,
Hi.
sir. My name's Diana. I'm your nurse today, taking care of little Gracie here. Can you tell me, first of all, a little bit about what's going on with her?
She just had a stopped up nose and a little bit of trouble breathing, it seems. So
I can see that. She's using her intercessory muscles here to breathe. Her color looks a little pale. Fingertips are a little bit of cyanosis there. Let me check her oxygen level for us. I'm going to go ahead and put her on a little bit of oxygen here. Her saturations are 88% on room air. I'm going to give her a little bit of humidified oxygen. She's having a little trouble breathing. She's got a bunch of mucus that's building up in there. That's keeping her from getting gas down low enough into her lungs.
can I just ask you why you're
Sure.
gowned up?
Oh, sure. When you came in through triage there, they did an initial test called a rapid antigen detection test, which tests for what we call RSV, respiratory syncytial virus there. And she was positive for that. So we automatically put them in precautions. I'm going to put them in droplets. So for droplets, I would normally be wearing a mask also,
Okay.
this, for like that, there. So sometimes our babies here fight this, so we might have to tape it down a little bit, and you can monitor. If this is too much, we can put a baby mask on her and use a mask on there to keep that oxygen on. So she's going to be on a little bit of 2 liters with some sterile water in here that's going to humidify that air for her to breathe a little bit and bring her oxygenation up for us.
So since she's had that test already, I mean, I understand it's a virus, but you use antibiotics for that to treat her, or?
Since it's a virus, no, we're going to go ahead and admit her. Doc already said he's going to admit her, put her up on the floor. We're going to monitor her by putting her on a continuous pulse ox machine here.
Okay.
And what we are going to give her are a couple of medications. One is a steroid called methylprednisolone. And that medication is going to decrease inflammation, because what RSV is an inflammation of the bronchioles there.
Okay.
It also increases mucus production because of that inflammation there. So we're going to decrease inflammation with the steroid there. We're also going to give her some fluids, because she can't drink very well. Her bottle's probably not taking too much nutrition in there.
No, she hasn't eaten a whole lot.
So we'll put her on some IV fluids to maintain her hydration for her while she's going through this. Complications that can happen, and they've done a chest x-ray, we're waiting for the results, are like pneumonia, or she can go into worse respiratory depression there.
Okay.
Okay, so we're going to just go ahead and monitor her, keep her there. We're going to keep the head of the bed up, or if you're in here holding her, you want to keep her elevated there. That will help ventilation problems that are going on for her. Let me listen to her lungs. The second medication we're going to start her on is a bronchodilator. Respiratory therapy comes and does that for us. Yeah, she's wheezing and bilaterally in both her lungs there. So what a bronchodilator does is it opens up the bronchioles so that air can get in.
Okay.
So if we decrease inflammation, then it's easier for that broncho to come in. I'm going to go ahead and give her a treatment right now. We're going to give it via a mask. So first we're going to put what we call albuterol, which is the bronchodilator, in here. Close it up. We're going to connect it to some air. She's already got oxygen going there, so we'll connect it to some air here so we don't take her off the oxygen. And you can kind of hold it. You can either put it on her head, or you as the parent can sit here and just hold it close enough, so because she's going to fight it, so she can breathe it. Normally we would have a pediatric one here, okay, versus not quite so big. And what that will do is you'll start seeing vapors coming through,
Mhm.
and she will be inhaling that, and it should open up that bronchioles to help her breathe better, help her get better oxygen there. So if she were to have any complications like the pneumonia, then we would start an antibiotic there. When we take
Okay.
her, while you're holding her there, I'm going to go ahead and take her temp, and we usually take our infants rectally. No, she's got a 99.8, so she's got a low grade. Again, that's just the immune system trying to start working. We're not going to give her anything until after 100.4
Okay.
in there. Again, this is contagious, so it winds up adults getting it, other siblings getting it in there. It happens for if they're in daycare in a crowded area, so they wind up being more susceptible to getting this virus. The reasons older adults and children don't usually get so sick from it, it just is a common cold. Our immune system kind of fights it because those are the simple symptoms. But with our younger infants, say a year and younger, they are more prone to having more pulmonary problems with it, respiratory problems. Takes their immune system a little bit to start working. So that's good. And so if I see that, or if you see that she's having trouble, she can have one of these as needed. They are scheduled every 4 hours
Okay.
for us. There. Do you have any other questions?
No, not that I can think of.
Okay, so let's get her up to the floor then, and we will continue monitoring her up there and giving her, start her fluids and her steroid up there.
All right.
All
Thank
right?
you. Appreciate
You're
it.
welcome.